Holistic evidence-based practice in our office compared to a traditional office is that we're not going to be throwing medications at you as a reaction to, say, like your labs, for example. So in the traditional practice role, there are standards of practice. So, for example, if you have high cholesterol and I give you the diagnosis code for hypercholesteremia, in a traditional practice, you have to check the box saying, okay, they have hypercholesteremia, I gave them a statin. At the end of the year, there's actually audits that happen in traditional practice by insurance company that if you don't have enough of those boxes checked that you've matched that diagnosis with a certain medication, that they actually get dinged and the next year's reimbursements go down slightly. It doesn't seem like a lot when it's like 75 cents a visit, but it is when you have thousands of patients. And so a lot of times in traditional practice, you've got 15 minutes with a patient. You're almost audited to make sure that that patient, if they have that diagnosis of hypercholesteremia, is paired with a statin. In a holistic environment like ours, it's going to be diet, it's going to be exercise. I mean, it's going to be based on looking at the whole person, not necessarily, okay, you have high cholesterol, here's a cholesterol medication. Same thing with blood pressure. It's not a, check the box saying, okay, we controlled your blood pressure. It's, okay, did we look for the root causes of high blood pressure? Like, a 5 to 10% in your body weight can significantly improve or hurt your blood pressure. Do you have white coat syndrome? There's lots of people that come in, they're not taking their blood pressure medicine because it was prescribed to them because they had one high blood pressure in the doctor's office, and they have to check that box saying, yep, I gave them antihypertensive. And a lot of patients don't even take it. They never take it because they say, well, at home, my blood pressure is fine.